I'm Dr. Marissa, and today I'm going to show you 5 medical checkups that many adults over 65 accept without asking a single question, because they trust the words, just to be safe. But listen carefully. Sometimes just to be safe is not safe at all. Sometimes one routine test finds something small, then that small finding leads to another scan, then another specialist, then a biopsy, then a procedure, then a complication, and suddenly a person who walked into the doctor's office feeling completely fine is now dealing with fear, medication, surgery, hospital visits, and a life that looks very different than it did before. If you are over 65, if your doctor often says, let's run a few tests, if you have ever had one test lead to another test, or if you feel healthy but still get sent for screening after screening, this video is not random. This video may be exactly what you need before your next appointment.
Because after 65, the question is not, can we find something? Modern medicine can almost always find something. The real question is, if we find something, will treating it actually help me live better, or will it start a medical chain reaction I never needed? Stay with me until the end, because I'm going to give you 5 questions that every adult over 65 should ask before agreeing to any routine test. Before we begin, type your age in the comments, and if you have ever had one test lead to more tests, type cascade. We don't do fear here, we don't do fake promises. We connect the dots. Now let's begin. The first checkup I would be very careful with after 75 is routine colonoscopy when you have no symptoms and previous tests were normal. Now listen carefully, colonoscopy can save lives. If you have blood in the stool, unexplained weight loss, bowel changes, anemia, family history, or previous polyps, that is a different conversation. But if you were over 75, average risk, no symptoms, and your previous colonoscopies were clean, repeating the test just because it is due may not always make sense. Here is why. A colonoscopy is not just a simple look. There is bowel prep, there is dehydration risk, there may be sedation, there is a small risk of bleeding or perforation. And in older adults, even the preparation can be hard on the body. The test may find a small polyp that would never have harmed you. But once something is found, the system often keeps moving. More testing, more follow-up, more procedures, more anxiety. That is the cascade. A patient once told me, "Doctor, I went in feeling healthy. I left feeling like something was wrong with me." That sentence matters because screening is supposed to protect your life, not steal your peace without a clear benefit. So before you accept a routine colonoscopy after 75, ask your doctor, am I high risk? Do I have symptoms?
What were my previous results? Would a stool-based test be safer for me? And most importantly, if this test finds something, what would we actually do about it at my age? That question changes the conversation. Your action step. Do not automatically say yes or no. Ask why. If colonoscopy after 75 surprised you, type colon in the comments. The second checkup I would be careful with is aggressive cancer screening in low-risk adults with no symptoms. This includes PSA testing for prostate cancer in older men and mammograms in older women when the person is low risk, has no symptoms, and would not want aggressive treatment. Now, I want to be very clear. Cancer screening can save lives, but after 65 or 70, the decision becomes more personal, because not every cancer found in an older adult is fast-moving. Some cancers grow so slowly that they may never cause symptoms in that person's lifetime. But once the word cancer appears on a report, everything changes.
Fear enters the room, biopsies begin, specialists get involved, treatment is discussed, radiation, surgery, hormone therapy, medication, side effects, fatigue, urinary problems, pain, stress, and sometimes the treatment causes more suffering than the cancer ever would have caused. This is called overdiagnosis. It means finding a disease that technically exists but may never have harmed the person, and overdiagnosis often leads to overtreatment. That is the danger. A test does not only find disease, a test can also create a path, and after 65 you need to know where that path leads before you step onto it. So before aggressive cancer screening, ask your doctor, if this test is abnormal, what happens next? If we find a slow-growing cancer, would we treat it or monitor it? What are the side effects of treatment? Would treatment improve my life or only change my scan? That last question is powerful because the goal is not just to survive longer on paper. The goal is to live better in real life. Your action step, if you are low risk and symptom free, ask for a shared decision conversation before screening. If this made you think, type cancer in the comments. Now stay with me because the third checkup is one of the most common traps. The third checkup I would be very careful with is routine cardiac stress testing when you have no symptoms. This one sounds smart. Your doctor says, let's check your heart. You think, of course, I want to prevent a heart attack. So you do the treadmill test or the medication stress test, and the result comes back abnormal. Now you are scared. The doctor recommends more testing, maybe a cardiac catheterization, maybe a stent, maybe blood thinners. And all of this may happen even though you never had chest pain, never had shortness of breath, never fainted, and never had symptoms during activity. That is the problem. In people with no symptoms, stress tests can sometimes create false alarms. And false alarms do not feel false when your heart is involved. They feel terrifying. Once your heart test is labeled abnormal, the system moves fast. But here is the question many people never ask. Will this procedure help me live longer or feel better if I had no symptoms to begin with? That is the real question. Because heart care is not just about finding blockages. Many older adults have some narrowing in arteries. The question is whether that finding needs a procedure or whether medication, blood pressure control, cholesterol management, walking, sleep, and blood sugar control are the better path. I am not saying ignore heart symptoms. Never. If you have chest pain, shortness of breath, pressure in the chest, fainting, or symptoms with activity, get medical help. But if you feel well and the test is just routine, ask before you begin. Ask, what symptom are we investigating? What happens if this test is positive? What is the chance of a false positive? Would treatment change if I feel fine? That one conversation can prevent a long road you may never have needed. Your action step: never let a heart test be just because. Ask what decision it will guide. If this one surprised you, type heart in the comments. The fourth checkup I would be careful with is bone density testing that automatically leads to medication without a fall prevention plan. Now listen carefully. Bone density testing can be very useful. Osteoporosis is real. Hip fractures can be life-changing, and some people absolutely need treatment, but here is where the mistake happens. A scan shows low bone density, the number looks bad, medication is prescribed, and nobody talks seriously about the thing that actually causes many fractures: falling. After 65, preventing fractures is not only about stronger bones, it is also about safer movement, better balance, clear floors, good lighting, proper shoes, medication review, vision checks, strength training, bathroom safety, grab bars, removing loose rugs. Because if you reduce falls, you reduce fractures. A pill may help the bone number, but a fall prevention plan protects the whole person. That is why I would never accept automatic long-term medication from a scan result without asking deeper questions. Ask your doctor, what is my actual fracture risk? Have I had a fracture before? What are the risks and benefits of this medication? How long would I take it? What is my fall risk? Can we build a fall prevention plan first? This is not about refusing treatment. It is about making sure the treatment matches the real danger. Because the danger is not just weak bones. The danger is weak bones plus a fall. Your action step: if you get a bone density scan, ask for a fall risk plan at the same visit. If you have had a bone scan, type bone in the comments. Now, the fifth checkup is the one many people have never even heard of before it is ordered: asymptomatic carotid artery ultrasound. This test checks the arteries in your neck that carry blood to the brain. And at first it sounds like a great idea. Who would not want to know if there is a blockage near the brain? But here's where it gets complicated. If you have symptoms of a mini stroke or stroke, such as sudden weakness, face drooping, trouble speaking, sudden vision loss, or one-sided numbness, then testing may be urgent and important. But if you have no symptoms at all, routine screening can create trouble. Because many older adults have some narrowing in arteries, the ultrasound may find it. Then the next conversation may become surgery or a procedure, and any procedure near arteries that feed the brain carries serious risk. So the question is not, can we find narrowing? The question is, if we find narrowing in someone with no symptoms, does fixing it help more than controlling blood pressure, cholesterol, diabetes, smoking risk, and heart rhythm? That is the conversation you must have before the test, because finding plaque does not automatically mean surgery helps. Sometimes the best treatment is aggressive medical management and risk factor control, but if you never ask, you may get pulled into the cascade. Your action step: if a carotid ultrasound is recommended and you have no symptoms, ask what symptom or risk factor makes this necessary. If it finds narrowing, would you recommend medication, monitoring, or surgery? What are the risks of the next step? Do not wait until after the result to ask. Ask before. If carotid ultrasound is new to you, type neck in the comments. Now let's bring this together. The 5 checkups I would carefully question after 65 or 70 are: routine colonoscopy after 75 when you are average risk and symptom-free. Aggressive cancer screening when you are low risk, symptom-free, and treatment may not improve quality of life. Routine cardiac stress testing when you have no heart symptoms. Bone density testing that leads to medication without a fall prevention plan. And carotid artery ultrasound when you have no stroke-like symptoms. Again, I am not telling you to avoid doctors. Good medicine saves lives, blood pressure control saves lives, diabetes care saves lives, vaccines matter, medication reviews matter, vision and hearing checks matter, cancer screening can matter when it fits your risk, heart testing can matter when symptoms are present, but after 65, more testing is not always better care. Better care means the right test for the right person for the right reason at the right time. So here are the 5 questions I want you to take to your next appointment. Question 1. What are we looking for with this test? Question 2. What is the chance it finds something harmless? Question 3. If it finds something, what happens next? Question 4. What are the risks of that next step? Question 5. What happens if we monitor instead? These 5 questions can protect you from the cascade effect. And if your doctor has good answers, you can move forward with more confidence. If the answers are vague, slow down. You are not being difficult. You are being wise. Your body is not a checklist. Your life is not a report. Your healthcare should protect your independence, your energy, your peace, and your ability to live well. Now I want you to comment one word. Which checkup surprised you most? Type colon, cancer, heart, bone, or neck. And if you have ever had one test lead to many more tests, type cascade. Your story may help someone else ask the right question. If this video helped you, subscribe, because in the next video I'll show you the common medication mistake many adults over 60 make that may increase dizziness, falls, and confusion. I'm Dr. Marissa. Take good care of yourself this week. You came here thinking every routine test was automatically safe, but you are leaving knowing that after 65 every test needs a purpose. You came here with a doctor's order, you're leaving with a map,